Welcome to another episode of Simon Says, where facts come first. I'm your host, Jenny Simon, and today I bring to you a midwife of almost 45 years. In fact, she delivered my daughter 27 years ago and my grandson 7.5 months ago. She was also my favorite primary school teacher. She taught me at what we called at the standard four. These days is grade four. She taught me at standard four, and she's a number of other things. She's a farmer and all of that. Interesting, very interesting individual. Um, so let me introduce to you Marguerite Sheriff.
Hello, Jenny. Thank you for having me here. And
Welcome to Simon Says.
you
Welcome
said,
to Simon Says. It's always a pleasure seeing you. And how are you? How are you today?
oh, well, I'm just recovering from that carnival flu. You know, the flu everybody gets during the August, but mine wasn't so bad
You know, they
because,
call it
I look
bungee.
after my health.
They call it bungee.
What is it called?
Bungee. That's a
Oh,
line from some soca artist song.
bunch.
Yeah.
Okay.
Yes, yes. So indeed, it's a pleasure to have you here. I've been telling them all our history on how far back we go. Um, so I would like you now to tell my listening and viewing audience something about Margaret. Tell us about your midwifery, how long you've been doing it, where, and you did a little bit, and you did some tutoring as well, some teaching throughout the world. So tell us about that.
Yes, Jenny, I was trained in the UK 40 over 45 years ago, I think. Oh my God, I'm showing my age. And prior to that, you said I was a teacher, but let me go back. I was a trainee teacher because in those days you did an induction course and then you were assigned to a senior teacher who guided you. It's not like today you have 5 O levels or 2 O levels and you just start before class and teach. No, no, no. It was done properly in those days, if I might say. Okay, so going on to my midwifery, I did midwifery. I did nursing first, but I love midwifery because for me, nursing, I was like a doctor's handmaiden. With midwifery, well, in the UK and other parts of the world, you're independent. I was an independent midwife. You're practicing independently of a doctor unless there is a problem. So I did that in UK. Then I had a spell in Africa volunteering, and then I went back to UK, and then I came back to Grenada in 1994 to set up my own clinic, because the reason for that is after years of working in hospital institutions, I realized, like so many other people, that the care of women the care was not holistic. You was viewed as bed number 12, bed number 6, and this spiritual, personal gentleness was taken away. So I thought, let me do my own thing and do what I believe, and there's been a lot of research into this, is correct. A holistic approach where you view the woman as not as a body, as a person, a human being, and you involve her family as well. Because if a woman doesn't have proper care during pregnancy and her family is not involved, then you have problems later on. And sometimes I wonder, with so many problems with young children these days, do you know that the outcome of a delivery, the woman going through labor, if she's not handled properly and her labor is traumatic, it could have a lasting psychological effect on the woman and on the child. So I did that for a while. And then, as one politician said to me when I presented a paper, on how I thought and saw how Grenada's maternity care could be improved, and I was ignored. So somebody with Doctors Without Borders, Médecins Sans Frontières, saw my project, and then I was invited to work with them, volunteer. So I first went out to Pakistan, which I absolutely loved, and I did a lot of training and teaching with the staff there. And then I went to other places, South Sudan, Iraq. Iraq was another lovely place. Sierra Leone, Bangladesh, Myanmar, different places. And I was invited to be the midwife to build capacity training of local, what would I call them here, traditional birth attendants, women who were not officially trained, and they needed their skills to be improved in order to reduce the number of child infant deaths and maternal deaths, and because lots of these places were very remote. There were no hospitals nearby and no diagnostics. So we had to do what we call obstetrics in remote settings. So you had to use whatever available resources you had. And for instance, in one of my places in Bangladesh, I taught like about 20 TBAs, traditional birth attendants, on basic hygiene to prevent infection during labor and after labor, and how to deliver, how to safely, how to not cut people with razor blades and stitch them in needle and threads, things like that, how to resuscitate a baby, how to recognize when things are going wrong, and you refer them to, in our case, in those days, you had to miles and miles away to the nearest higher facility. So I did that, and then I came back to Grenada, and I wasn't interested so much in getting back into midwifery because it's a lot of hard work, but I wanted to do another path of growing vegetables and fruits. So I went back into my farming, should I say, which I do enjoy. And I see a birth as growing because you plant a seed and you have to nurture it, you have to water it, you have to talk to it, you have to do all these sorts of mothering things, the same way you do to a woman, you do it to your plant. So I sort of see the similarities with those two, and I do enjoy that. And yes, a few people asked me to deliver the babies, and somehow I got back into it. Not a lot, just a few. And I've been delivering now children that I delivered years ago, 20 odd years ago.
Grandchildren now.
Grandchildren now.
Grandchildren now.
So
no,
it's lovely.
Yeah, I did a program last week. A couple that had some issues up at the General Hospital, at the maternity ward. And I specifically sent the link to you because I wanted you to see it, because I knew I was going to bring you on to follow up. What is your take on what happened? I mean, just listening to Shanna and her partners, they're backing her up, and the loss of their baby Dawn. What is your take on that?
Gosh, that was so hard to look at, Jenny. It broke my heart. I mean, I'm not here to judge anyone.
Yeah.
I just listened to the couple, and there's some, and it's believable. I have no, I cannot say, oh, that didn't happen, that what you're saying is not true, and so forth and so on. Mm-hmm. But let me go back a little bit. and talking about a midwife is a trained professional who is skilled and knowledgeable in providing full antenatal care during pregnancy, which should include parent-craft classes to educate the mother on what happens next. She does clinical examination, screening, and she identifies high-risk pregnancy, and those high-risk pregnancy must be referred to an obstetrician who is trained also in dealing with problem pregnancy. A midwife is trained to recognize the problem, but not to treat. She is then supposed to send that woman to the hospital. Now, we talk about skilled and knowledgeable. Skilled doesn't necessarily, well, a lot of people think going to university, coming out with a degree in nursing or whatever is skill, right? But it isn't. You gain knowledge, but then the skill needs to be translated. The knowledge needs to be translated into skill. And this is where you go into the hospital and work alongside a senior midwife who can teach you and guide you as to what is supposed to do, a woman is supposed to do. And that should include empathy, sympathy to the woman and her partner, her relatives. Now, the other thing is, if a woman is educated sufficiently during her pregnancy and is told the signs, explain the signs, the symptoms of labor, and when to go in and when not to go in. The first thing that struck me in this video, the woman said she had a plug of mucus, which is what medical term, obstetrical term, the operculum. It's a thick plug of mucus which blocks the neck of the womb to prevent infection going in while she's pregnant. Now, that doesn't mean to say you're in labor. It means that your body is getting ready for labor. Now, if you're educated enough and you're low risk, you should not have gone into hospital so early. Going into hospital that early creates problems. It does create problems. So that's number one thing that struck me. She went in too early. The other thing she said, she was a week overdue. Now, one of the researchers that I have looked at and seen over the years and listened to is that a week overdue doesn't mean to say that something is going to go wrong. You have to intervene, right? Intervention sometimes creates more problems. Now, had she not gone in, she would not have been interfered with. The interference with no medical, obstetrical emergency to say that this woman needed to be induced, that's a problem. So those are the two things that I pick up.
She said she was induced. Some PG, they put some
prostaglandin. Right.
Yeah.
I'm glad you mentioned prostaglandin there, because one of the comments I made, and people might think I'm a bit wild, have some hot sex. Where do you think the prostaglandin comes from? The semen, the sperm, the semen. That's where it comes from. That's what they use. So if you think that you're overdue, what put the baby in can get the baby out, right?
Yeah.
So sex might have started her off naturally, gently, enjoyably, you know? And also another thing, sometimes your rectum is too full. You know, you have to ask questions. No, you're overdue. Let's start you off. Have you had your bowels open? A full rectum can stop the descent of the head. That's another thing we should be asking, but we don't. Okay? The other thing is you could have done, if she's full of, you know what, you do an enema to empty that space to get room for the head to descend. The other thing you could do gently is a membrane sweep. Okay, but before doing all that, you need to check, is the baby at risk? Is the mother at risk? If they're not at risk, leave well alone. She's not at risk, leave her alone. Is the placenta functioning properly? That's the thing, because as the baby gets older, the pregnancy gets older, the placental function diminishes a little bit. But we are not absolutely sure when conception took place, because we're saying, oh, she is a week. How many people have gone for an ultrasound and they said you're going to do on the 9th of September, and the baby comes 28th of August, or
later,
a few weeks later? Nobody, very few people have the baby on that date, Remember that. So a week over, to me, in the absence of diminished placental function, she hasn't got gestational diabetes, she hasn't got any of these other high risk things. So say to her, go back home, have some sex, and come back when the pains have started, or something like that. And you ask her to make sure and check the fetal movement. Because you can check a woman in clinic today and you haven't educated her on other things that she can be doing herself. Because remember, this is a partnership here. This is with the carer and the woman. The carer doesn't know everything. The woman doesn't know everything. But together, you explain. Your woman tells you when she last had a period, what's happening to her, whether the baby is moving 10 times a day from sunrise to sunset. That's how I ask women to check. Sunrise to sunset. And that is an indication, that might be an indication that something might be going wrong. So if the woman is educated and she knows to check her fetal movement, to check whether she's having headaches, epigastric pains, this sort of thing, then you can say, okay, all of those are negative. There's an X against all of those. There's nothing wrong with you. Go back home and wait until labor starts. You know, education is very important here.
Yeah.
So that's the two things.
They helped her along with the labor. They did something called stretching.
Oh gosh. That's another terrible thing. This stretching of the cervix could be very dangerous. You could rip a woman's cervix by stretching. You don't need to do that. Let the woman get up and walk around. But you know, as this stretching thing again comes in because she came in to the hospital too early, right? She came in too early. So when you go in, they need justification as to, for why you're there. We have to do something because you're there. We have to intervene because you're there, and this sort of thing. Instead of just laying back and let nature take its course while you observe and you educate the woman to tell you how she's feeling, what's happening. This is what went through my mind when I'm seeing that video,
Yeah.
Oh.
So, well, you did part of it. My next question, I wanted you to explain the difference between a midwife and the doctor, the obstetrician, and the importance of midwives trained and midwives on the ward or in the clinics. I mean, before, lots of pregnant women did not go to the hospital to have their babies. My mom had 6 of us, and 5 of us was born at home, and from the nurse in what we used to call the surgery.
Mm-hmm.
When they go into labor, the nurse would go to the house and deliver the baby. My elder sister, she said she used to see the nurse come up with a little bag. My mother would say, everybody go outside. Then she see the nurse going back down with a little bag. Well, first she had a baby cry, then the nurse gone back down with a little bag. 5 of us born at home. Only my last brother was born at the hospital.
Same here, Jenny. Same here. All my siblings, we were all born at home except the first one, because in those days when you got married, you stayed home with your mother until you built your house. So therefore, there wasn't enough room and privacy. And he was born in the hospital, but the rest 5 of us were born at home. And I remember my last brother being born at home. And we were like very nosy, listening. It was, I think, it was Nurse Gittins. She delivered me in Nurse Gittins, I remember. I mean, I don't remember the delivery, but I've been told that she delivered me and other people. And we were born at home. But remember, we have become so, what's the word? I wouldn't say westernized. We've become so posh or whatever. We feel you have to go into hospital. We're forgetting that in those days, number one, the transportation wasn't that good. We didn't have as many doctors around, and I'll come back to the word doctors in a minute. We didn't have telephone systems so great. Now today we have more medical stations. I think the last count went 2009. I counted 34 medical stations, health centers, whatever, throughout Grenada, Carriacou, and Pretty Martinique. That is absolutely brilliant. But we have centers. Who do we have in the centers? Right? So delivering at home is much better if a woman is low risk.
Yeah.
Okay? And I'll tell you why. Think we are supposed to be animals and we're supposed to be highly intelligent and educated. Animals, when they go into labor, usually it's in the night, most often than not, when the body is at rest. They don't get up and go, I'm going to the veterinary surgery and have my pups or my lambs or whatever. They stay quietly. The owner of the animals will be at the sidelines, making sure things go all right. And if something goes wrong, the vet or even that farmer would take the puppy or the lamb out or the calf out or help assist the animal. But we now that we have better transportation, better communication systems, everybody's got a cell phone, the roads are better. So why can't we, and let me go back one little step, 80% of pregnancies are normal. 80% are low risk and normal. So tell me, why are you removing 80% of the women and putting them with sick people? Now you asked me about obstetricians and doctor and midwives. As I said earlier, the midwife is trained. She's a trained professional who deals with normal pregnancy, labor, and she looks after the mother and the infant. I know it might be up to 28 days afterwards. She issues the birth notification so that the baby can be issued with his certificate, birth certificate, whatever. An obstetrician is a trained doctor who specializes in pregnancy and especially so abnormal pregnancy. People here tend to forget that and they say, I'm going to the doctor. Now, let me make an example here. Now you have a contractor. Oh, he's a contractor, he builds houses, and in the houses you have electricians, you have plumbers, you have masons, you have tilers, and all of these things. Now, if your plumbing is not right, he's not going to go and call the electrician. Or if your electricity is not right, he's not going to call the mason. Now, why can't it be similar with the doctors and the midwives and obstetrician? Now, if a woman has something wrong with her pregnancy, she's experiencing some sort of problem, I don't know what it's, some problem. I'm going to the doctor. If she goes to the doctor is a clearinghouse, and he should say, or she should say, okay, I'll refer you to the obstetrician. Do you know, in Holland and England and many places, when a woman is pregnant, the first person she sees is a midwife. Because assuming that 80 or even over 80% of pregnancies are normal, why would you need to go and see somebody who is specialized in sickness, in pregnancy also, because you have to know the normal in order to know the abnormal. So you need
Margaret,
to get...
We don't have midwives though. To me, and we don't have, I don't know how much we have, if we just have one or two on the ward and the maternity ward, but in the clinics, do we have midwives for persons to go there for their prenatal and for that midwife to come at home to see them through their labor and birth?
Well, I don't know too much about that.
Because most of the primary healthcare are not functioning. And that has been so for a while now. And that is one of our problems. And even from listening to Shanna, even getting on the ward, it doesn't seem as though they were trained properly and experienced midwives and junior doctors on the ward to take care of her, even when she was actually in labor.
Right. I got that. And that was very, very sad.
We have to deal with. Midwives is great. I was happy to have you to take care of me and my daughter. But how many of you we have around?
Unfortunately, when I came back to Grenada, we had wonderful midwives in the clinics. Oh, I love them. And, most of them are retired. They're my age. They're retired now. But they were knowledgeable. And I always remember them saying to me, when Dr. Noel was around, and if we call him in the night, he knew it was for a section because he respected the midwives. There seems to be lack of respect for midwives these days. I don't know why. Don't ask me. I'm not judging, right? But this is something I heard over and over again from those wonderful midwives. There's so many of them. I can call names, but I might forget somebody and I might think, oh my God, I forgot me. But they're still out there. So what we need to do, and another thing I heard from a few of them is, oh, these nurses go down to SGU and do a degree, and when they come on the ward and they know nothing. Now, this is the other thing I talk about, knowledge and skill. That's the difference. You know the knowledge, you taught ABC in the classroom, but if you're not there to do the on-hand, the hands-on, clinical and observe, because to learn, you look, you listen, and then you do. You cannot be listening without the actual doing. There's 3 processes of learning, right? So they come onto the wards, and I still chat to a few of the lovely nurses who have retired, and we always say this, oh gosh, the nurses these days, you know, they come back and they have a degree and they think they're better than the other nurses who have been there for a long time. That is sad because their skills are lacking. And I think it was a sad day when they had stopped training midwives at the hospital. Somebody told me, a nurse told me the other day, that they had resumed the training of midwives. I don't know how true it is, but it's like the doctor and the obstetrician and midwife, and you have the nurses and midwives. So you see, the nurse is not she's not trained. She might be trained in nursing skill, but she's not trained in midwifery. And when I trained to be a midwife, I had to do 40 deliveries, 18 months between classroom and the wards. And then you follow a senior midwife, you follow a senior house officer, but more often than not, it was the senior registrar and the consultant. The consultant, more often than not, was about 50, 60 years old, because in those days, you couldn't just, I see people training coming out of medical school and then they say they're consultants, but you need that experience. When I trained as a midwife and I qualified, I went to University Hospital of Wales where I gained experience, and I had the supervision of other senior midwives and registrar. And then I was left on my own to train like nurses who were doing obstetrics as part of the nursing course, and medical students who were doing the obstetrical training, 3 months obstetrical training. So I was able to impart the knowledge to the medical students and the midwifery students and the nursing student. But here it seems as though somebody becomes a doctor, and then tomorrow I see a sign on the road, doctor here. It reminds me of Bangladesh and these places. You become a doctor and then you're in the, oh, fuck, I better not go there. Anyway, so.
Right, so we quickly running out of time.
Wow.
I just want you to, what's your opinion on the way forward? I mean, what do you see? How do you see us moving forward? Just give us some closing remarks on in that area, of course.
Okay. Now, the way forward, bearing in mind 80% of pregnancy are normal, we do not need to go into hospital. We have good facilities. People say go to the hospital, but remember, the hospital is only a structure. We have clinics out there, lovely clinics. I've been to the one, there was a lovely one in Tivoli that was opened up in 2008, 9, whatever. The one in Guelph, beautiful and posh. Where else? There's a complex in Sates, St. David's down here. I used to go there and help the nurse. There was, they were doing deliveries there, and I would look out and see a light, and I would go and help the nurse there. And I remember one night I went down there, there was a woman with twins. She didn't have antenatal care. She had high blood pressure, blah, blah, blah. And I got down there. The nurse called me, in fact, to help her. And nobody knew she was having twins. But after the first one delivered, I said to the nurse, don't give her the oxytocin, which is a drug you give to contract the uterus to stop the bleeding. Let me check. And there was another baby. So the way forward, use those health centers. Train, number one, you have to train the nurses. You can't have health centers without personnel. Train personnel. Train the nurses to become midwives or have direct training into midwifery, which could last 3 years. Then use those facilities. You have Maryborough polyclinic. I wouldn't call it a hospital because there's no theater, there's no x-ray. I don't think there's x-ray now. I don't know, whatever.
A big polyclinic.
A nice big I like up there, a polyclinic, and people in St. Andrews and maybe part of Sautez can go to Sautez Polyclinic. Those in Grenville, St. Andrews can go utilize the one in Tivoli. That's nice. They have beds and all sorts of things lovely there. You have Guelph for Victoria and St. John's. St. David's, you have St. George's, and well, if you have problems, the health center here could be upgraded. And I remember once they were thinking of upgrading it and they asked me to run it, but politics come into play and everything goes out the window. So we need to get these clinics with staff to run them properly.
Yeah,
we have
that's
to be,
what we need.
Yeah, training plus. We have to stop the silliness about those professionals who return home and want to help, and stop saying and treating them with all this nonsense. Where she come from, where she thinks she from, and all this kind of stupidness. I know one doctor, skilled surgeon, who wanted to help in the hospital. He didn't want money. He wanted to go in and have doctors see how to learn from him. Have some of these midwives who have trained long ago in Grenada. We have, in fact, the training long ago in Grenada is the same as what I trained in England. Same system. So we are not better than them. They are not better than us. We are on par. Now, get those senior midwives who have retired to come in, to volunteer. I went and volunteered in Iraq, all these places, and people appreciated me. But here, they don't. As the politician told me, I'm so sorry to hear that, but a king has no honor in his own land, when he spoke to me from Pakistan. Now, stop this nonsense. Put aside your egos. And stop this who she thinks she is, and embrace people who are coming back. Embrace the midwives who have been around for a long time here, who want to give back to your country. It's not what your country can do for you, but what you can do for your country. And that is so sad that many people wait and say, oh, I vote for X, Y, Z, I will get this, I will get that. That really infuriates me. And that's why people will find me I'm not very diplomatic, because I call a spade a spade. I'm sorry, I call a spade a spade. And this nonsense has to stop. We have the systems. We need to embrace what we have and put trained professionals. It's like people saying, let me go a bit now. Oh, we need to get Carlton House. You get Carlton House. Who are you going to put it for? Is it only a building? Oh, you're pregnant. Yeah. You must go in the hospital. You go in the hospital. If something goes wrong, it's only a building. When you do one-on-one care at home with a midwife, and they have loads and loads, Jenny, you have to do another program on this, loads and loads of research to show that home births is safer in the absence of all medical high risk things than going into the hospital, because you're comfortable in your own home, your own smells, you like less risk of infection. Look, when they had the COVID, people were scared to go in the hospital. Some of them went in and came out with this COVID, so we need to get things on par, get the old midwives, I shouldn't say old, the experienced midwives out there who are retired, bring them in and let them work out the way forward, because something has to give. There have been too many bad reports coming out of the hospital, and that last couple, it just broke my heart.
Yeah. In other words, we need to have our primary health care up and running.
And running properly.
Properly, and properly staffed and everything. Margaret, thank you so much for joining me today. It was an interesting conversation. As you said, I'm going to bring you back. We have lots of things to talk about. As I said earlier, and you're very diverse, and I know that my viewers would love and listeners would love to hear some of what you have to say. So I'll bring you back when I know you're a busy lady. You have to run off to where? It's in Grenville now, you said? So we would bring you back and so you can give us some more of your experience.
Yes, Jenny, but I think, sometimes I get very passionate about my midwifery, as you can see. I get animated and very passionate because I love it. And if you love something, you do it well. You don't do it because, it's a secure job. I know I get my pay at the end of the month, whether I do bad care or good care. Yeah. I love what I do. I'm passionate about what I do. And that's why I get very animated.
Yes. And that's one of the issues I think we have as well, the passion, passion and compassion.
Mhm.
We lack up there at the General Hospital. We do have nurses who are passionate and they like what they do. But
Mhm.
I don't know if it's the pressure they're under, they're overworked and underpaid. There are lots of stuff that's happening behind the scenes as well. But I always say, if you're doing something, no matter what the pressure is, if you like it, you would do it to the best of your abilities, yet for all. You understand? Or else don't come in. If you can't come in and
Exactly.
don't come in. You know,
Exactly.
it's to me, it's as easy as that. So as simple as that. It's not as simple as that for everyone, but I pray and hope that because we've been having endless, quite a few fetal mortality, the mortality rate, fetal mortalities, and even parental along. In some case, both mothers gone in, mother and babies died, and that sort of thing. And we really, really don't want it's lives we're talking about here. So anything that I hope they engage you after you've been on Simon Says, I hope you get engaged by the powers that be to at least help and put systems in place and help in training of the young nurses who are interested in midwifery to training and even some of the junior doctors, because
Mhm.
you saw Shanna saying the doctor was saying, I could do this, but afraid. And I wonder if I'm doing this right. That's what a junior doctor
Oh
working
God,
on
you
a
don't
maternity
say that in
ward,
front of a patient. You don't say
right?
that in front of a
So
patient. Gosh.
even they need some kind of experience until they probably go on. Sometimes they don't. They just stick around on the maternity ward for as long as, and they don't go and specialize, working under a consultant. So we need some help. We really do need help in all sectors of our healthcare system. However, the maternity section needs special attention because that's where life begins for people. That's where life begins.
Jenny,
Thank you.
can I
Thank
just
you
say
so much.
something? As you
Oh
said, that's
yeah.
where life begins. Now, this is aside from everything else. People, there was this talk about LGBTQ, whatever. Everybody should be respected. And if you want to talk, this is aside from everything. If people want to talk and educate people on LGBTQ, what percentage of the population are LGBTQ? What percentage of the population will have children? What percent of the population will get pregnant? Shouldn't we be
Yeah.
focusing on that more
Yeah.
than
Yeah.
LGBTQ? Respect
Yeah.
everyone. They should be respected as well.
Yeah.
But I think we need to focus on what's important to us right
It's
now.
important. Life.
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 Mhm.
Thank you. Thank you.
Thank
Have
you,
a great
Jenny.
day.
Bye-bye.
Bye
Okay, you
bye.
too. Bye-bye.
Mount Pure Natural Mineral Water begins as rainfall, which percolates through the untouched rainforest and rocks of the Roll River Mountain. This natural filtration system protects the water from pollution, giving us a unique collection of minerals from the natural underground artesian aquifer. The water then flows naturally to the surface under pressure without pumping. As it reaches the surface, it is directly piped and bottled at our processing facility. We ensure that the water stays pure and safe so that it is ready for you to enjoy the excellent taste and natural health benefits. Not all water can make the grade when it comes to natural mineral water. Mount Pure offers a consistent composition and purity, so we can tell you exactly what you are drinking. Mount Pure guarantees you a perfect taste every time. Don't say water, say Mount Pure. Taste the difference. Enjoy the benefits.
Thank you for tuning in to Simon Says. To ensure that you never miss an episode, click subscribe and make sure to turn on the notifications by clicking on the notification bell icon. See you at the next episode. Welcome back. Just to continue along the healthcare lines, recently, in the parliament, they had the supplementary budget, and we had an allocation for a new hospital, and well, to purchase lands for a new hospital. Some 89 acres of land in Calavini, costing 35 million EC dollars, and they need a down payment of half, 15 million, as said by the Attorney General in the Senate. 15 million was allocated in that supplementary budget for lands, for the down payment of lands for the new hospital. And I'm glad to hear Margaret talk about the structure is not what is important. It's just a wall. It's just walls. But the what happens inside there? So you can have your child under a mango tree. You can have your child in the car, in the ambulance, on the way to the hospital. You didn't get to the building, right? And this is something I've been saying for a while now. We need a hospital. Sorry, yes, we do. We would need a hospital in a better place where the traffic, the roads are narrow. It's a fire hazard, really. And so we do eventually. But since they made it like a one-way in, one and the other way out, it's much better that traffic not meeting up against each other. If the ambulance have to come or the fire truck, it'll be okay. We need to fix the healthcare system first, and to me, that's priority. Right now, that 15 million that we're going to pay down, the down payment on the lands, can do a lot for our healthcare system. Purchase medication, purchase simple medication, antibiotics, painkillers, bandages, materials, implements, equipments, right, to save lives. We need reagents for blood work. You can't have people going to the hospital, they're patient in there, they have to draw the blood, and the families, members of their family, and whoever is there with them have to take this blood, trips across the carronage, if you don't have transport, trips across the carronage with this blood sample in your backpack or your handbag to be tested. Some of these blood work has to be done over in some cases. The heat outside there, they need to be kept cool, right? And the simplest of blood work now, Grenadians, our citizens, have to go to private clinics, and I have no issues with the private clinics, but if you're in the hospital and they take your blood work, there's a lab. There's a lab there that you're supposed to be able to send it to the lab quickly to get, in a matter of days, it should be in hours in some cases, to know what's going on, right? I know of a patient who died at the General Hospital recently, days after attending her granddaughter's graduation at the convent. She was, okay, right? She started having chest pains, went to the emergency. They figured out she was having, she had a heart attack, a mild heart attack, doing ECG. They put her on the ward to run tests, blood work. You have to go get blood work done. And so while on the ward, in a matter of a week or two, she had another heart attack and died. Her family was distraught because they saw her the day when she died later in the evening. Spoke, laughed, chat. But she was on the ward waiting for blood work. And she died. It is distressing. We need to think about our people's lives to save lives. That hospital is a hospice at the moment. Is where people go to die, and you're not even hospice. I shouldn't even say hospice, because hospice keep you comfortable. That's where you go, you're comfortable, and they, nurture you and so until you die. So I wouldn't even say it's hospice, because it's uncomfortable for the most part, right? And so we need to improve that. Government after administration after administrations campaign on better healthcare. Better healthcare does not mean a better structure. The administrative part, division needs help to start with. One of the young lady who lost the twins, when they sent the information to the undertaker, to the funeral home, they sent for one. Remember, one of the twins died in her, and she was going to the clinic, and they didn't observe that. When she started to feel really ill and a lot of pain and so on, she went to the hospital. That's when they realized one of the babies was dead in her. So they took her to surgery and they removed both babies. The other one died 3 days later. That one that was in her, there's no registration of that baby. So that baby doesn't exist. When they went to the funeral home, they told them, well, they only sent us information for one baby and it's too late now, and la 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 la. So that right now, that baby doesn't exist. We need proper administration. We need proper health care. Forget the new hospital for now. Yes, it was your campaign promise. But what people would admire you for more and appreciate more is the saving of lives. So let's fix the one we have there. And I'm not talking about the walls. I'm talking about staffing. As I said, best practice suggests 1 nurse to 5 patients. Go on any ward in the hospital where they have 30, 33, 35, 25 patients. And you have 1 nurse and 1 nursing aide for the most part on a ward, right? So we need proper staffing. We need to increase our staffing, both nurses and doctors. We don't have an oncology ward where people to take care of our cancer patients. Every Saturday, a DJ truck going around begging for help for people, for eye care, for kidney care, you name the care. A student get injured while playing sports, and we have to have a truck going around begging. Sometimes by the time the family come up with the monies needed, the person dies, right? Or when they get to where they're going, it's too late in some cases. We have to stop that. It's about time. And if you're going to transform, let's start there. Let's start transforming our healthcare. Let's start transforming our healthcare and saving lives. People going into the hospital for minor healthcare issues and coming out dead, or coming out with major ones. Forget the structure. Buy medication, buy reagents. I can't stress it enough. Staff, better staffing. Make the temporary workers, the temporary nurses, make them permanent. They are still leaving. They're taking your $500 and they are leaving. They're still going for greener grass. They're migrating. They are overworked and underpaid. They've been overworked and underpaid, but it's getting worse instead of better. And your care about, your minister who was in an accident and everybody run up there, the prime minister. And I have a grandmother called from Florida calling the minister about her grandson who died, and wanting to know, what's going on, because you get what they told them in the hospital and the autopsy said 2 totally different things. Reason to suspect malpractice, or you understand? Speak to the people. No, they can't find you. You're always busy. I've seen the thread in WhatsApp with our conversations with the minister. I've heard his voice note saying he's so busy. Stop and think about lives. Stop and think about that. Too many people are mothers, young mothers are losing their babies at the general hospital. And some of them are losing their lives as well. In some cases, mother and baby. In some cases, babies live, mother dies. In some cases, babies die, mother. It's just too much. It's too heartbreaking when you hear the stories. Since last week, I spoke to someone who had a worse situation than Shanna and Dawn. People, mothers been messaging me of their issues, plenty. Members of their family. Someone messaged me, my sister, I could understand, I could relate. My sister had the same exact treatment. So it's not a fluke. It's not one in a million. It's plentiful. It's happening. They're probably better off staying at home and let their partners or their family cut their cord and try, as some people used to do before we gone back in ancient times. We have, listen, when I spoke about primary health care a while back, and maybe about 2 months ago, and about a week later, the minister and some of his colleagues from the Ministry of Health, they went to Guelph, St. John's, and they launched primary health care. I came back and I did compliment the move because I was asking for primary health care to be introduced speedily. I got updated on that polyclinic in St. John. As you heard, it's a beautiful structure, right? Because it's not been run as a polyclinic to date. The facility is running far from its capacity. The opening hours is from 7 a.m. to 1 p.m. and from 1 p.m. to 7 p.m. So they have 2 shifts. 7 p.m. closed down. So in other words, you can't get sick, you can't have an emergency after 7, you'd have to still come to town at the general hospital. Staffing, 7 persons work from 7 a.m. to 1 p.m. and 4 persons work from 1 p.m. to 7 p.m. Doctors working there, 1 doctor worked there and he works 3 days a week, Monday, Wednesday, and Friday, from 9 a.m. to 12 noon. He don't go there to see, don't go there to see the doctor after those hours, right? So no doctors on Tuesday, Thursday, Saturday, and Sunday. And the staff work nights only on weekends, Friday, Saturday, and Sunday nights. So Monday, Tuesday, Wednesday, Thursday night, there's no staff there. The place is closed, right? The services offered there, testing for pressure, dressing, seeing the doctor, well, whenever he's there, minor, superficial, right? You still can't go there to have your baby, right? It's run as a regular clinic, as a regular health center. And even in some cases, some health center, I think, should be open at night, right? And that's when you have an emergency and you go up to the hospital, there's always a long line up there at the emergency, and you sit there for hours. Primary healthcare would help. And I'm saying again, please, please attend to a primary health care system. You heard Marguerite speaking of the different clinics around the island that should be run as polyclinics with midwives and doctors staffed. And of course, I've always said it, Maribo is not a hospital, it's a big polyclinic. And lately, I've seen in social media, several persons complaining about the service up there at Maribo and it being very understaffed. Imagine some people said they were waiting in the emergency up there, waiting to see the doctor, and the doctor's hours was up, and left before the other doctor who was supposed to take over came. And I think who never showed up anyways. But the doctor was complaining they were tired, and you can't blame them because you cannot see patients if you're not mentally there. You're tired. It's just like the pilots, and so doctors need a certain amount of time for rest as well. Yeah. You're not going to get into a tired pilot who've been flying for 24 hours. And how many hours? No, they have to change. You need to be mentally there. Right? So this is what's been going on up there at that big polyclinic we call Maribo. Fix our hospitals, Princess Alice in Carriacou, so that patients don't have to come down to Grenada, take a boat to come down for emergencies. Fix it. Okay? So that we can save lives. We need the capacity. We need the people. We need the people. We're only 100,000 strong. And all the most of the CBI people that ban the passports, they're not coming here to stay. They just want the passports. So we need these babies that are dying. That's count. We need them. So we can have, build our capacity, which we need in a lot of ways. Folks, thank you for joining Simon Says as we wrap this episode. Thank you for listening, for being a part of the conversation. As usual, keeping them honest. Join us next week, same time, same place, for another episode of Simon Says. Enjoy your week. See you later. Bye.
Pure natural mineral water begins as rainfall, which percolates through the untouched rainforest and rocks of the Roll River Mountain. This natural filtration system protects the water from pollution, giving us a unique collection of minerals from the natural underground artesian aquifer. The water then flows naturally to the surface under pressure without pumping. As it reaches the surface, it is directly piped and bottled at our processing facility. We ensure that the water stays pure and safe so that it is ready for you to enjoy the excellent taste and natural health benefits. Not all water can make the grade when it comes to natural mineral water. Mount Pure offers a consistent composition and purity, so we can tell you exactly what you are drinking. Mount Pure guarantees you a perfect taste every time. Don't say water, say Mount Pure. Taste the difference. Enjoy the benefits.
Thank you for tuning in to Simon Says. To ensure that you never miss an episode, click subscribe and make sure to turn on the notifications by clicking on the notification bell icon. See you at the next episode.